The vulnerable population I will be discussing today is refugees. Refugees are those who are unable or unwilling to return to their country of nationality due to persecution or fear of persecution related to their race, religion, nationality, social group, or political opinion. The following conditions make them more vulnerable to health disparities: poor living conditions, change in lifestyle, poor access to health care, language barrier, and working conditions. There are currently 26.3 million refugees worldwide. The United States houses about 10%. In Utah, there are 60,000 refugees. Mostly they reside in Salt Lake City. Utah refugee admissions are below the national average. The national admission of refugees has seen a decline since 2017, when the cap of refugee admissions was significantly decreased. The significant decline in refugees is also as a result of the travel ban placed by former President Donald Trump. A significant number of refugees that were coming to Utah were from these countries that are now banned. Healthy People 2030 determinant of health relating to refugees would be racism, discrimination, and violence. As seen in history and in recent months, racism and discrimination are ongoing issues. When you have individuals from another country and culture enter a new country, it can be difficult to understand and acknowledge these differences, which can lead to violence. Specific concerns that disproportionately affect refugees. Physical would be poor sanitation, lack of clean water, inadequate food, and poor shelter. According to the WHO, 85% of refugees are hosted in developing countries. Due to being housed in these developing countries, this can be a threat to their physical health, leading to illness and possible death, and due to lack of resources. Psychosocial could be isolation, PTSD, language barrier, and human trafficking. These concerns affect this population because they are unable to speak their language, which can frequently lead to isolation. PTSD, which also can be anxiety, depression, are more prevalent due to their situation, especially when human trafficked, and human trafficking can also be an issue due to the vulnerability of women and children. Economic concerns would be unemployment, low-paying jobs, language barrier, again, and poor education. These concerns are mostly related to the language barrier. They're unable to get employment, or when they do, it's a low-paying job. This can also be related to poor education and not being able to speak that language, leading to poor economic status. The root cause of health disparities for refugees is the language barrier. Having a language barrier may result in trauma, mental health issues, education, lack of education, and stress. It can also be difficult to seek medical care. They may be afraid to seek medical care. It can also be difficult to find a job. It can result in low socioeconomic status and lack of education. This language barrier can be especially difficult to children. Refugees and Maslow's hierarchy of needs. Refugees are lucky if safety needs are met, but often physiological needs are not met. If physiological needs are not met, it can be difficult to continue up that hierarchy of needs. And as stated earlier, according to WHO, 85% of refugees flee to developing countries, so they may not have access to basics of life, clean water, food, and shelter. But you first must meet these needs prior to moving up the hierarchy. The anticipated functional level of this population is safety, to ensure they receive health care and the needed resources. But again, you must meet those basic needs first. Health outcomes for refugees in terms of physical health may be met, but as for emotional health, they may not be. Because in order to reach that self-actualization of Maslow's hierarchy, you have to meet each level, and due to many differences in culture, families being separated, and not being respected by those in the country you have fled to, it can be difficult to achieve the highest level of need. Communicable diseases or infections common for refugees. The CDC has a list of communicable diseases in different regions in which refugees come from, and here are some of them: tuberculosis, STIs, hepatitis, malaria, Zika virus, and parasitic infections. Refugees are at a higher risk of communicable diseases due to lack of screening resources, vaccinations, and education. To decrease transmission, detection is essential, and resources to test for disease often can help to prevent, and education can also make a difference in health outcome. Non-communicable diseases or conditions common for refugees. Again, here are some of the most common: hypertension, diabetes, thyroid disease, anemia, lead poisoning, malnutrition, and genetic disorders. Prevention may be screening for hypertension and diabetes, screening for thyroid disease, labs to determine deficiencies, early detection of genetic disorders, and the management may be diabetes, exercise, medication and supplements, and early intervention. This population is at higher risk for self-care deficit due to not having the needed resources. As I've said, they usually flee to underdeveloped countries and may not have clean water or the supplies needed for self-care. And they can also be at a higher risk for self-harm related to PTSD. They often have seen family members killed and been torn away from their families, which can lead to this PTSD, more anxiety, depression, and can result in self-harm. Refugees are also at a higher risk of being harmed by others, and this can be due to discrimination, low socioeconomic class, and lack of safety. And refugees can also be at a higher risk for harming others due to their PTSD. And to decrease this harm to themselves and others, it's essential that they seek help for mental health illnesses. If they are not struggling with mental health illnesses, they'll be able to function at a higher level and will be more likely to get out of their current situation and decrease that risk for harm. And these are my resources. Thank you very much.